Good afternoon, everyone, and thank you for tuning in today to our media advisory. I want to start off by reminding everyone that while retail stores in Hamilton remain open under the enhanced red category of the provincial COVID-19 response framework, I encourage everyone to avoid large crowds and stay at home if possible. Please continue to support our local businesses safely this holiday season by shopping online and utilizing the curbside pickup or delivery option. Now more than ever, we need to show some local love by shopping local. At the same time, continue to put our trust in the health experts by following their recommendations. That being said, I was pleased to see many retail establishments implementing the additional restrictions needed to help lower the spread of the virus, reducing the capacity and limits at shopping malls and retail establishments, active screening at workplaces and shopping malls and retail businesses, posting capacity limits based on physical distancing requirements, and appointing a manager to develop, implement, and actively monitor a safety plan in workplaces, shopping malls, and retail businesses. I can tell you anecdotally, I was at Fortino's who put all of those measures into effect almost immediately, with counters at the door, folks taking screening questions and directing traffic to make sure that everyone was physically separating. It was impressive to see, and I hope all establishments are putting those practices into place, and enforcement is active today. And Paul Johnson will tell you more about that shortly. Winter activities, while we're encouraging community members to avoid unnecessary trips outside the home and limit close contact with those they don't live with, it's important that we all find ways to keep our physical health and mental well-being. And so we know the risk of COVID-19 transmission is lower outdoors, and as long as precautions like physical distancing and proper hand hygiene are followed, you can take advantage of those outdoor opportunities. So today I'm pleased to share the launch of the new Winter in Hamilton program, featuring dozens of safe opportunities for getting outdoors and getting this exercise. So visit www.hamilton.ca/winter to see an extensive list of the kinds of activities available to residents this winter in Hamilton. There is something outdoors for everyone, including skating, tobogganing, some new winter trails, and activities at the golf courses. And I know Paul Johnson will provide some additional details on the Winter in Hamilton program in just a few moments. And please remember, the safest option is to choose activities that can be done with those you live with. If you meet up with others, choose activities that allow you to keep 6 feet of distance between you. Hamilton, please do your part and continue to follow advice of our public health team to prevent the spread of this virus. I'm now going to pass it on to Paul Johnson, our Director of Emergency Operations Center, to share some more details around all of those items I just talked about. Thank you, Paul.
Well, thank you, Mr. Mayor. And I just want to start today talking a little bit about enforcement. Last week, there was a major blitz of enforcement that was augmented, our normal enforcement that happens each and every day with our COVID officers that are out morning, noon, night, 7 days a week doing their enforcement. We were joined by a provincial enforcement team made up of officers from a number of ministries who are assisting with the enforcement of the regulations under the provincial guidelines and obviously our control category of red. Number of businesses were visited. The provincial team alone visited 550 locations. Our folks were out doing even more than that. And a number of charges were laid. Of course, the provincial ones, we don't know who they took that, but we will be following up on certain occasions with that. The whole idea here is to make sure that people are aware of the regulations and the requirements and that they're following them. And although it is disappointing whenever we see charges laid, because it's, again, people not following the rules, it is pleasing to know that even with that blitz happening, that it is very few individuals and businesses that had fines or charges brought against them. So the message is people are adapting, as the mayor said. People are trying to do their best to understand the new restrictions and put them into place very quickly. And we do recognize things come into place quickly. We do that because we need to stop this as soon as possible. We need to take action to stop the spread as soon as possible. It's not something that can have a 10-day implementation period. These numbers and the reasons why we're doing them, as you'll hear in a minute from Dr. Richardson, are pretty significant that we do everything very swiftly. So our appreciation to the retail spaces who started on Saturday doing this, and to the workplaces that were arriving on Monday morning needing to put this into place as well. And those enforcement pieces will continue with support from our provincial partners, as well as our own local bylaw enforcement folks. I want to shift gears a little bit to some work that we've been doing for a couple of weeks now and getting ready for the winter. We know that indoor recreation, at least in the short term, is going to be fairly limited, and that's the reality of where we are, but it's also, of course, the higher risk level that comes with indoor activities for longer periods of time with lots of people. So having large hockey tournaments and basketball tournaments and all those are just not part of what's happening, as everyone knows. But what we do want to encourage is for people to be as active as possible. And so where those indoor things do exist in small numbers, continue to encourage people to embrace that and do it safely. But more so, we can get people outside and enjoying activities. And what a great time to figure out where your winter activity and winter recreation passions are. And at the City of Hamilton, we're here to help. As the mayor mentioned, winter in Hamilton has always been there. Lots of activities every year in the winter. But this season, we're hoping that more and more people can engage in those activities and get themselves out and get themselves active. At hamilton.ca/winter, you can find all of those things, some of which we'll be building over the weeks as we add more and more activities. But there will be outdoor skating available, and we will have different ways of running it. They will be staffed. We will have reservation systems in place so that people can book and come and enjoy a time on outdoor rinks, because the numbers will be limited, but those facilities are there. We have volunteers that operate rinks, and we're working with those volunteer organizations who will be opening their outdoor rinks as the winter goes on. So lots of opportunity to get out and skate. It may be very limited right now in our indoor arenas, but there's going to be more activity outside, which is just great. There will be limits, as we say. We are encouraging people to wear masks when they're doing this activity. You're working a little harder, so you're breathing a little heavier. And the other thing is even 25 people move around some of our skate loops and then some of our skating rinks. Of course, you can't always guarantee you'll be that physical separation distance apart from someone else. Tobogganing hills we've talked about, they will be open. And so we have 4 permitted tobogganing hills at the Shadoke Golf Course, the Martin Course, at Garth and Stone Church and the Reservoir, Kings Forest Golf Course, and at the Waterdown Memorial Park. So tobogganing, once we get snow on the ground, will be part of there too. But the big thing is all the trails. We're going to be maintaining some trails in Hamilton that are great for walking or cross-country skiing, snowshoeing, or getting around in some way. Our golf courses, we are going to be allowing some participation there for snowshoeing, walking around. You won't get ticketed by bylaw for being on there. And in fact, at Kings Forest Golf Course, we're going to open a new 2.7 kilometer marked and maintained path so that you can actually get out onto a path. For those who aren't perhaps as open to going cross country, you can find a nice path that's going to be put in place. It's 2.7 kilometers, so that in and of itself gets you out and gets you a little bit of that physical activity. We're going to continue what we started last year, which was very successful with winter golf at the Shadoke Golf Course. And the other parts of the golf course that aren't being used for winter golf will be available for activities as well. But we have 254 parks, 288 play structures, and they're all open, folks. 13 dog parks and 5 sets of encampments. You can tell where sometimes my mind drifts to escarpment stairs that people can be walking up and down, and they're going to remain open. So to do things safely, of course, remember to take some extra precautions in the winter. It is snowy at some points in our winter. Obviously, each year it gets icy. So we make sure you've got the proper footwear, and make sure you take just a little more care, because it's not going to be the same as walking on the paths or the trails as it is in the summertime months. Obviously, keep distance. We're encouraging mask wearing if you're out and there's people around you in some of these places. And if you go somewhere, as always, and you find it to be very popular at the moment, then just find somewhere else to go. As I say, with 254 parks, with all sorts of trails, and then our Conservation Authority partners have trails as well. There's lots of chance for activity and opportunities for folks to get out and enjoy things. We're looking at a couple of additional new items to come online in the coming days, looking at ways that people can get out and enjoy time together, particularly over the holiday period. We know the schools will be off as they are every year for a couple of weeks around the holidays, and we know families will be looking for things to do. So stay tuned to that website. We'll continue to update any new activities that are there. But Hamilton is full of great ways to get outside and enjoy recreation. It's critically important we keep moving. It's critically important we get out there and have a chance for some exercise. And it is also a lower risk activity, not no risk, but lower risk activity for us to be doing it outdoors. And we think that, most days you can get out and do that. Just wear the right clothing, buy the right shoes, and things should work out. So I want to tip my hat to all the staff, not just in our recreation division. It crosses all the departments of our city, public works, planning and economic development, with all of their winter activities as well. There's lots of opportunities for us to get out and enjoy this community in the winter months. And thanks to all the staff that pulled together the list that's currently on our website and the ideas that keep coming forward as the winter goes on. Details about when things will open will be on the website. Of course, we're not quite there yet in laying ice in all of these places because the warmer temperatures are going to be here at the tail end of this week. So there's no point in laying it now. We'll wait till we get into a little colder weather and make it all happen. We'll have it all there online for folks. So thanks very much for allowing a few extra minutes for me to share what's happening in those winter months, because as Dr. Richardson will agree, as much as we have to be safe and do all those things about staying close to home and whenever we can, we do have to get that exercise. It's a huge public health issue for all of us, and we're trying to do our part at the City of Hamilton to support that. Now over to you, Dr. Richardson.
Thanks very much, Paul. And, it's fantastic work that's been done by all of our colleagues, as you said, in planning and active, in public works, in culture and rec, in recreation and in culture as well. As we've looked at what we can do as we go forward, and it's so important for our physical health, as you underlined there. It's important for our mental health. We know that physical activity is one of the things that's really important in underscoring all of our mental health and getting outside. There's a beautiful sunshiny day today, so I took a little break and got outside at lunchtime and just enjoy some of that. But it's just, as we're talking about being a resilient community, and that's really what we have to be being as we go through these difficult times. Whenever we meet these times and look at ways that we can become more resilient, that really helps us grow as a community, as individuals, and really keeps us healthier in the long term. So grateful for all of those that are putting them together, to our Conservation Authority colleagues, to everybody who's looking at ways that we can support people as we move forward. So I am going to bring you the facts and stats, which is unfortunately still seeing us at high numbers of cases. Today, we're at 3,672 in total. That's 90 new cases from yesterday. We're at 637 active cases, so we continue to see highs as we go forward. We've now topped the 100 death mark, unfortunately, with 3 new deaths that have happened over the past week, or the past weekend. 2 of those are females from Grace Villa, one of them in their 90s, the other in their 70s, and a gentleman from the community in his late 80s who passed away on December the 6th, just yesterday. There are 23 outbreaks still ongoing. We've been in and around that 20 number now for some, good week or so as we've been looking at this. No new outbreaks today, but certainly some new ones that happened over the weekend, and more details are, as always, there on the website. And while you're there taking a look at those numbers, just remember it's really important to look at those numbers that reflect the trends of what happens over time. So that case rate per 100,000 population, the weekly incidence rate, I should say, per 100,000 population, currently sits at 83. So we're still well up there, as we said, and concerned about as we go forward. So along that line as well, I just want to talk a little bit about case management and contact tracing. And we are seeing people who are not giving us all the information when they're being interviewed in our case rates. And it might be that they don't understand the importance of it, that it really is essential for us in terms of working on control. Or they may feel a little embarrassed because they don't want to admit that they were out and socializing, because we've been saying a lot about that. Or it may seem stigmatizing for some people in terms of what they're doing, and or they may not believe that they've transmitted the virus. So don't worry about that. And it's really important for us that we do get that information. So what we're doing is we're trying to determine when that virus might have been acquired, if there's settings where that virus is being transmitted. And that's really been a crucial piece of what we've been able to do here in Hamilton, is identify those places, identify places that are having outbreaks, so we can work hard to bring them under control. Whether it's a long-term care facility or a retirement home, if it's a business, if it's just working with individuals to understand what their risks are. It is absolutely crucial that we get all of that information and work with you in terms of ensuring control in our community. I know, of course, that the isolation requirements and quarantine requirements can feel very inconvenient. And we talked about this a lot in the late spring when we were in the end of phase one or peak one, where it can feel quite onerous if you need to stay home for those 10 days, if you have become sick, or quarantine for 14 days if you've been in contact. But it's these smaller costs that the individuals in our society do pay that plays a major role in reducing transmission for all of us, hopefully getting us back down out of the red zone over the next month. And very importantly, preventing a shutdown, a lockdown, which would have bigger economic consequences, or worse yet, in terms of the number of cases overwhelming our healthcare system, and preventing not only those with COVID, from being able to get all the care they need, also those who have heart disease or cancer or those sorts of things might not be able to get the care they need. And so that's why it's so important we get the information and that we work with you in terms of the isolation, the quarantine. And as you've heard the mayor talk about last week and over many months and weeks and months now, the importance that we're really pushing at the provincial level and federal levels around things like paid sick leave and those sorts of things to support people so that they can do what needs to be done when it comes to COVID-19. So that's it for me today, Mr. Mayor. I'm going to turn it back to you.
Thank you very much, Doctor, and Paul Johnson, for your comments and input and information. And we look forward to some questions from the media. But before we do that, I do want to encourage people to follow these recommendations and reinforce the message that we've got to stop this virus. The more that we do to protect our most vulnerable and to protect our economy, the better off we're going to be, either now and into the future. So the vaccine isn't here yet, and it may not be here for some time. And even if it is, there are still measures that we're going to have to take to ensure that we protect others that haven't been vaccinated. So this is going to be a while longer, and we need you to stay with us and do everything you can to follow the recommendations. I, along with the other Greater Toronto Hamilton area mayors, will continue to meet, and we will continue to urge the senior levels of government to find ways to support people and businesses through the next few weeks. Some of the things that Dr. Richardson just talked about. So doing that will ultimately help reduce and prevent the spread of this virus. And we are trying to control this spread as much as humanly possible. And it's simple to say, but certainly for some folks, difficult to do. Stay home whenever possible. The increase in numbers we're seeing is extremely concerning, and we're quite honestly frustrated by it. And we would like to get your help to prevent the spread from continuing and increasing and potentially leading to a further lockdown, which is certainly not desirable for anyone. So let's continue the hard work, and let's also thank all of those that are taking the measures that are being recommended. You're doing a fantastic job. And as I said earlier, I see lots of places doing exactly what they need to be doing. If we can get them all doing it, we're going to be much, much better off. On that note, Jasmine, I'm going to ask you to go to your media partners and ask for any questions.
Great. Thank you, Mr. Mayor. As usual, we'll start with one question and one follow-up for everybody. First goes to Phil Perkins from CHCH. Phil, you can go ahead.
All right. So you guys can hear me, yeah?
Yes, we can.
Okay. So I drove around the city, went to some workplaces, a law firm, architecture firm, and a bank. And it seems like they have the city posters basically asking employees and customers to, in a way, screen themselves before they walk in. Is that what the city had in mind about the new measures that were implemented today? Or does someone need to be standing there screening and reviewing the answers and then allowing people in a workplace or not?
So what we're asking people, the businesses, the retail outlets, is to work through with people as they come into their business or their workplace, those questions. And so they may have a poster up and be referring to it to ask them, like, have they looked at those questions? Can they go through them? Do they have any of those? It is meant to be active screening that goes on rather than just the posters, but certainly having the posters prominently displayed could be a big part of that.
And in the write-up, it says that these questionnaires can be done remotely. Does that mean someone does it at home? on that website using that Ontario link? And then how are they supposed to share that result with their employer?
So when we're talking about the remote screening, that's for workplaces by and large, and so that's asking them to. They could go through and do, say, an app if the workplace has developed an app or something similar to that, and it is that they could go through that before they come into work that day, and reporting that in, and then if they're clear, being able to come into work.
Great. Next question to Matt Ingram, also from CHCH. Matt, you can go ahead. Are you there, Matt?
Unmute. Hey, can you hear me? Sorry, I was muting myself like
yes,
so many
we can.
people are doing these days. Hi, thanks for taking my question. It's about the vaccine. Today's big news from the Prime Minister. A lot of people excited about that. I was wondering if the city could share what stage we're at for how they will roll out the vaccine and who's going to get it first.
So when it comes to the vaccine, and there's exciting new news that's coming this week, and we still have our federal and provincial governments working out exactly who's going to have the vaccine, who the priority groups are. And so we'll be looking at that information as that comes available and looking at how we roll it out here. We've got a group from across the hospitals, primary care, paramedics, public health, who are working together, as well as a group that is getting together at the city level to look at how we roll that out. But the setting of priorities comes from our provincial colleagues.
And in terms of the logistics here in Hamilton, are you guys working on what the logistical plan is going to look like, how this is going to work? Any information you could share would be great.
Yeah, absolutely. We've been talking with the province in terms of that, as they've asked, where could we store, very cold temperature vaccine in terms of the Pfizer product. We've been talking about, what it would mean for different players to be involved in it, but we're really still waiting for those specific answers around the priority groups and exactly what we're going to get when in order to decide the finals in terms of the logistics.
Great,
thank you.
Thanks. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question today. My first question is for Dr. Richardson. So as we're continuing to see these high numbers, sort of what has kept us out of lockdown so far, and what, are we still in danger of getting there, or what would it take to get there?
Yeah, absolutely. We're still in danger of getting there, Joanna. That's if these case rates continue to go up, we continue to see that our hospitals are really pressured. If things continue to get worse, then we'll continue to have those conversations with the province and the chief MOH, and ultimately cabinet will have to make the decision about what's going to happen for us in terms of lockdown. So, we are at very high numbers. We're very concerned about those, very concerned about what it can mean. We've put in additional controls in order to address that. And then, we're going to need to give it a little bit of time to see whether or not this is working. Both we've already had now 3 weeks in red, and we've got just started really today with all of the measures around workplaces, and we'll keep tracking it and see where we go and keep talking with the province.
Thanks so much. And I think, Dr. Richardson, my next question is for you as well. In other areas such as Toronto and Peel, there have been certain pockets where you see very high numbers, or those areas are very hard hit. Are we having that here in Hamilton? Like, do you see pockets, and where are those pockets?
Dr. Richardson, we just have you on mute there.
There we go. I did the other way around now, Jazz. We do have the map that's up on the website that shows you where the cases are in Hamilton by their residents. And so the challenge is that's not always where, of course, the transmission's actually happening. It can be happening in workplaces. It could be happening in health facilities in terms of long-term care homes, if that's a site. So those numbers can look larger in those particular areas. So when we're really looking at things and looking at where transmission is happening, we're finding that it is a result of either an outbreak that is happening in a workplace. So we're seeing much more of that than we were seeing beforehand. And so you see those workplaces that are posted up on our site. We're definitely seeing, unfortunately, some larger outbreaks in long-term care homes. And so you'll see those that are up on our website. And we continue to see it just diffusely throughout the community in terms of socializing and those kinds of those kinds of circumstances.
Great, thank you. Next question to Christine Rankin from CBC. Christine, you can go ahead.
Perfect. Hi there. Thanks for taking my question. And I believe it's also for Dr. Richardson. So with school-related COVID cases continuing in Hamilton, how sure are we that schools aren't in part causing the spread of the virus?
Yeah, it's been, something that's been top of mind for everybody as everybody went back to school in September about how were schools playing out in terms of a role in spreading the virus. And what we see is that the risk in those early elementary grades, sort of up to grade 4, grade 5, we really don't see much transmission there at all. We do occasionally see it in those that are in that slightly older age group up through sort of grade 8. And then in the high schools, that's where there's really a greater risk of transmission, but still mostly we see it amongst the adults rather than amongst the kids in terms of that transmission. So they're not major sites at all for us. We have had the occasional outbreak, but those have all been low numbers. They're not like the workplace sites and other sites that we've been seeing.
And on that, what kind of consideration, if any, would Hamilton give to asymptomatic testing in schools?
So the whole asymptomatic testing sort of pilots and regimes that are going on are all being organized by the province, and they've been looking at different testing modalities to use for doing that. So they have some of these now rapid tests that don't perform as well as when you do the nasal swabs and you send them in to the major labs. But they are something that they're looking at and working through. So that's really being worked through by that task force, data collected and looking at how they might be used.
Great, thank you, Dr. Richardson. We'll go through again for a second round of questions. So first can go to Phil Perkins. If you have another question, Phil, you're welcome to ask it.
Yeah, real quick. Is there a reason why the guidelines for these the screening is, I think it's in English and French, and that's about it. Are there going to be more languages added to that? Because at least for some of us here, it was a bit tough to find to begin with, and we're thinking it'd only be tougher if English was a second language.
Yeah, thanks, Phil. That's a good point. I know for a lot of us in public health across the province, we've been able to produce things in English and French, but not get them translated up to that level. And so that's definitely been something we've been looking at and encouraging, sort of sharing and centralization of some of those things. Definitely an issue that we're aware of and we'd like to move forward on. We're hoping to do that in a coordinated way.
All right, that's it. Thank you.
Great. Next, we'll go to Matt Ingram. If you'd like to ask another question, Matt.
Yeah, thank you very much. I was wondering if I could hear from the mayor on this one. Mayor Eisenberger, in the release today about the GTHA mayor's meeting, it mentions that all the municipalities are working on their vaccine rollout plans, but also suggests that maybe you're going to be looking for some financial support from the province and federal government to get this all rolled out in Hamilton. Can you talk to me a little bit about that?
Yeah, absolutely. And, one of the challenges that we're facing is that all of the folks that are now currently engaged in contract tracing and all the issues that surround the vaccine, the pandemic and the virus are folks that are still going to be needed very much to continue to do their work as vaccination rolls out. So the staffing, the ability to have locations and the ability to have those locations staffed is going to be very, very challenging for municipalities, and it'll require additional staffing and additional resources to put all of that into place. And so we're actually ringing the bell to say, look, don't necessarily rely on municipalities to pull staffing from all the contract tracing and all the pandemic protection work that we're doing, because if we do, then we lose all of that and a shift to the vaccine side. So it's going to need additional resources, additional staff, and we are asking the provincial and federal governments to ensure that those additional resources are there so that we can actually implement. We want very much to be successful in the delivery of the vaccine. We think it needs to be a very active and well-coordinated partnership between the federal, provincial, and municipal governments. And we're just saying to both of those levels of government, our staffing components are stretched doing the work they're doing now, and it's going to require some significant additional staffing resources to be able to pull this together to ensure that it goes successfully and smoothly.
Great, thank you, Mr. Mayor. Next question to Joanna from the Hamilton Spectator. Joanna can go ahead.
Hi, thanks so much. My question can be for whoever is best to answer it. As this vaccine rolls out, the health minister said today that they know what hospitals in the province have a freezer that will have the capability that's needed for this. And Toronto has talked about starting to find venues for, vaccine rollout. Do you know what hospitals in Hamilton, or if there's anywhere in Hamilton that has those type of freezer capacities? And have you started picking venues for vaccine campaigns?
Yeah, thanks, Joanna. There's been work done both locally and provincially in terms of looking at where those vaccine fridges are. So the province was asking the hospitals to pull together where they had them. We're fortunate because we are a research center that those kinds of freezers are used for research purposes. So we do have some here in Hamilton as well. The way the vaccine's packaged in terms of Pfizer's vaccine, it does come in a way that it can be delivered to a site and then be maintained through the packaging that it's shipped in at those very cold temperatures, as long as it's well maintained. So we do have those. And then we have identified some of the sites where we might be able to do vaccination. But as we get this new information that the province is putting out, we'll be looking to finalize that.
Great, thank you. Last question to Christine Rankin. Christine, you can go ahead.
Perfect, thanks so much. So there are a couple programs running right now to make sure that people with moderate COVID symptoms don't have to go to hospital. And I was hoping that perhaps you, Dr. Richardson, could talk a little bit about why, other than overwhelming the system, these would be good programs.
Thanks, Christina. And I love the way you frame that in terms of other than overwhelming the system. They are really good programs. And I think as we have gone through COVID-19, there's been a lot of exploration of ideas that we know can serve us well, well beyond issues such as COVID-19. So when we're looking at these programs, it keeps people in their homes, able to be cared for in familiar environments, means that they can have the supports that they need to feel comfortable, to feel well in those places, and have access to the people that they need. They can often then stay with loved ones rather than being in a hospital environment, which can be very disorienting, especially for older people, or disquieting for people. It's not the best place to get a good night's sleep, when you're talking about those kinds of settings. So there are lots of reasons why it's a better environment for us. And of course, we do unfortunately know that sometimes, infections are also transmitted in hospitals and those sorts of settings. So it keeps us out, keeps us at home, where we can get better care because we've got those people helping us through the monitoring programs.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you.
Okay, Jasmine, thank you. And thank you to the media for those insightful questions. And we look forward to continuing the dialogue this coming Thursday at 7 p.m. We're having another town hall on Cable 14. The theme of that town hall will be preparing for the holiday season, the virtual gathering, supporting small businesses, and safe shopping. So hopefully some thoughts and ideas about how we can manage our way through what is going to be probably one of the most unprecedented Christmases we've ever experienced, certainly in my lifetime, and I'm sure in the lifetime of most of all of you. So feel free to tune in on Cable 14 at 7 p.m. this Thursday. We will have that town hall with that theme. Thank you, Bill Custers and the entire team at Cable 14 and Clear Cable. All of you are making these broadcasts run smoothly and making them very possible. So thank you for that effort. And we thank our community, and please ask you to continue to adhere to all the public health measures we've talked about and keeping them in place. If you're sick, stay home. Keep your distance from people you don't live with. Wear a mask indoors or when maintaining physical distancing is a challenge, and keep washing your hands and wiping down those contact surfaces if you're in spaces that lots of people attend to. So if you are someone that you would like to know more information on COVID-19, our response, and the red zone, please visit the website at hamilton.ca/coronavirus. And lots of information there in terms of the ongoing supports required for those in our community that are struggling financially or otherwise, and all of the details around the red zone and the regulations, again, requirements, not suggestions, but requirements that you're going to have to put in place if you're a business and you're maintaining public access to your facilities. Let's be thankful we're not in lockdown. Some are thankful, some might not be, but I think right now at this time of year, Christmas, upon us, it's great to have some access to local shopping and your ability to support local. But at the same time, you can support local by going online and using the click economy and the curbside pickup. That can be very helpful and useful and still allow you to support local businesses without getting into contact with anyone particularly. So thank you all for taking the time to listen in, and take care of yourselves, stay safe, and we will see you Thursday at 7 p.m. on Cable 14 for our next town hall.